Hi, my name is Beth and I'm going to be talking today about the poster I made on dysgraphia. English is one of the most important subjects that students learn throughout their schooling careers. The English language is broken into 5 areas, which are writing, spelling, listening and speaking, reading and grammar. And in these 5 areas there are many different learning difficulties and disabilities that affect their English skills. Dysgraphia is a writing disability. It affects some students' literacy, in particular the area of writing. So dysgraphia is a learning disability where students' writing skills are usually below average for his or her age or cognitive level. Writing can be as simple as producing written letters and words, but it can also be really complex for students. They have to plan, organise, writing and proofreading a text. Students who are diagnosed with dysgraphia are diagnosed with a disorder of written expression, meaning that they can generally communicate verbally way better than they can written. Writing is a highly complex process that a lot of students tend to struggle with. However, some students tend to have issues with 7 types of neurodevelopmental problems that can cause writing difficulties, and these include attention, spatial ordering, sequential ordering, memory, language, higher order cognition, and graphomotor. Students who are diagnosed with dysgraphia tend to have issues with multiple areas that cause the difficulty. However, in this poster I've explained lots of ways that help specifically with graphomotor, which is one of the most common difficulties that the student may have. When a student is having difficulty learning to write, it's essential to find out what is causing the lack of knowledge, so then the assistance can be correctly targeted. A good way to tackle the idea that a student may have dysgraphia is through some sort of diagnostic assessment. It's kind of like a pre-assessment that allows teachers to determine a student's strength or weakness, and depending on what diagnostic assessment is chosen can determine what type of difficulty a student is having. So in this poster I've included 2 specific interventions that a teacher can use to move forward with a student who has dysgraphia or is being diagnosed with. The first one is touch typing. It's an important intervention as it allows the teacher to communicate more freely with a student. Students who have dysgraphia sometimes have a massive roadblock for teachers and students' communication, as a student might not know what they want to say. No, they do know what they want to say, but they might not be able to physically write it on words. Another intervention is in-hand manipulation, allowing students to use their hands to manipulate objects. For example, repositioning a pencil, using the only one hand to do so. So in this I explain multiple ways that you can do in-hand manipulation, which include chopsticks, placing small objects or edibles on the table and have students manipulate the chopsticks to pick them up. This gets their fine motor skills going really well and eventually will help them have more grip strength on their pencil. Also same thing with cotton swab painting, scissors, projects and lots of coin collecting. Giving students fake money or counters to a student in an old purse can ask them to pull out a specific amount of money. This now incorporates math, however it's important that the student uses translation to work on moving the coin from their fingers to the palm of their hands. And I've also included a resource list for teachers who are beginning to look into dysgraphia or need some extra guidance with students who may have dysgraphia in their classroom. That is all on my poster today. Thank you so much for listening.